guys, it's Wolf's Rule 100, and I wanted to film this video. I talked about this in my vlog yesterday, but I wanted to film an official video just on this subject. So I wanted to talk to you guys about what you should expect, or kind of what I went through when I job shadowed my vet yesterday, which was a lot of fun. So job shadowing is basically where you follow around somebody from your career that you're looking forward to going into to see if this is something that you really want to do. For me, this experience came up because I have a 12th grade paper due on my chosen vocation, and for doing that, we had to job shadow, at least for a day, our chosen career. And mine is a vet tech. So, I job shadowed at my vet. So, if this is something that you guys are going to do, I'm just going to kind of tell you how my day went down. Now, of course, every clinic is different, so you might not get the same exact experience. But I was really nervous. And so, if this video helps even one person, then that will be wonderful. So, they told me to show up when they opened at 7:30. You're going to want to call. I called 2 days ahead and figured out what time they wanted me to show up, just so that I was sure. As far as what to wear, I wore jeans and sneakers. You're definitely going to want tennis shoes or something of that sort, because you're going to be on your feet basically the whole time. And a nice shirt, but not fancy. Somewhere in between. It was a button-up, 3/4 sleeved shirt. Now, when I got there, because I am a minor, I'm only 17, my mom had to sign some papers saying basically that the vet is not held responsible if I get bit, scratched, anything happens to me. They're totally and completely exempt from any responsibility. If you're over 18, you will sign this yourself. And then my mom left, and the vet tech took me back. So the very first thing that they had me do was they had me meet the vet, and he was really, really nice. And this was probably the most part I was nervous about. Like, okay, who am I going to be shadowing? Who am I going to be following? Who's going to be kind of showing me this stuff? He was awesome, and it was a pleasure to follow him around and learn. As far as what you're going to be allowed to do, touch, this was one thing that I was really interested in. Most of the time, the only thing I was allowed to do was observe and ask questions. Ask lots of questions. Now, there's a time and a place for asking questions. Do not ask questions don't even talk, basically, when the vet is in the room with the client. The best time to ask questions, found out for me, was when he either openly started showing me something so I could ask questions about that subject, or when he was taking the time between clients' rooms and he wasn't writing anything down or talking to the tech. There was nothing going on. There was waiting for more patients. Those are the times you ask questions. Don't talk when you're in the client's room. Just observe. Now, I didn't know if I was going to be allowed to go in the exam rooms, but I was allowed in every single exam room that day. I did not observe any surgeries because it was a Saturday, and they don't do surgeries on Saturdays, but he actually invited me to come back on a weekday so that I can observe surgery. So if you go on a weekday, you might be able to observe surgery. So it started with, like I said, meeting the vet, and then they gave me a tour of the clinic. Now, he gave me about half tour before clients started coming in, and he wanted me to see the patients. So I got a half tour, and then I started going into the clients' rooms with him and seeing the patients. Most of the time, I stood to make sure I was completely out of the way, and I could see what was going on and observe, but I wasn't in the way of the client, the pet, or the vet. And don't stand next to the door either, you're going to get whacked. So, be prepared to see different things, and be prepared to see the usual things, cute things, and be prepared to see animals in pain. Now for me, because I want to be a vet, I knew that I was probably going to see all three of those things. If you don't think you're going to be able to handle them, then this may not be the chosen career for you. But that's the whole idea about shadowing, is you can kind of figure it out. So, I followed him around, and just giving you a couple examples, most of what I saw was vaccinations. There was puppies, it was cute, but there was also a couple cases that was more interesting, or not the normal vaccination. Things I hadn't seen in person before, because the only time I've really taken my dog to the vet was when he had heartworm and when he got his vaccinations. That was it. So I got to see them, how they performed the test. I saw a dog that had dry eyes, that came in with symptoms of a lot of mucus coming out of its eyes. The vet guessed dry eye. I would never want to guess that. Something you learn. You learn a lot by just watching. And I got to see them perform a test to test the tear production and kind of see them get the medicines and talk with the client about this. There are some things you may see that some people may think are borderline gross or nasty. I didn't. My sister, I was explaining to her what I saw, and she was completely grossed out. So, there was a dog who got bit by a brown recluse. He was in for a recheck, and there was a big wound on his chest. Now, for me, I was fascinated. But like I said, be prepared to see different kinds of things. There was times where you need to kind of make yourself out of the way and not be too close or whatever, because there was a dog that came in, that was a drop-off, that couldn't use its back legs. It was old, and the vet basically said he needed to talk to the owner on the phone, and they were discussing putting the dog to sleep. So those are the kind of times where you make yourself scarce. I kind of stayed next to the vet tech that was working on putting things into the computer from the past 2 cases. Do not follow the vet back into the room if he's trying to talk on the phone to a client. Overall, and then after I saw a couple cases, there was a gap of time where there was nobody there, and then I followed the vet was trying to write down stuff in the computer, get caught up, so the vet tech gave me a tour of the rest of the clinic. And so, most likely they'll give you a tour of the clinic. She really took the time to explain things. I got to see the surgery suite and everything in between. Now, also, do not touch things. Do not, and this is kind of just proper etiquette. They didn't exactly tell me this, but it's kind of a given. Don't go around, don't touch, like, in the surgery room, don't touch things. Okay, things are sterile, so, yeah. That's just a given. Kind of keep your hands at your sides. You don't know what you're going to see. I didn't know what I was going to see. And after about 2 hours or so, the nervousness kind of wore off, and I was just enthralled by everything. There was a dog who came in with a what's called a collapsing trachea, which is prominent in small breeds, where basically it's exactly what it sounds like, their trachea collapses. And so, in this case, the owner was distressed, but the vet wasn't too worried about it. They gave the dog a steroid, and this is what I'm talking about right here, about seeing animals in pain. This particular shot they had to give the dog really made it yelp and scream, but it was for the best, and the dog was fine. So, yeah, just be prepared for that. And the rest of it was basically just vaccinations. There was a dog that came in that had a mass on its leg. It was just really interesting to see. It's kind of enforcing the fact for me that I want to be a vet, because you don't know what you're going to see. No 2 days are the same. And then I followed around the tech, and she kind of showed me some interesting things. Now, I don't know if you'll be allowed to do this, but she let me look at blood, and there was a puppy who had roundworms, the roundworms underneath the microscope. She also took the time to explain to me how they do the heartworm tests, and she did actually let me feel a chihuahua, she let me feel its pulse. I don't know if you're going to be allowed to touch the animals. I didn't think I was going to be allowed to touch the animals. For the most part, I did not touch the animals. But that is a given, and so don't be afraid to ask the vet a lot of questions. Just make sure that you're asking at the right time, and remember to smile, and just generally learn all you can. Soak it in. Ask yourself, is this what I can see myself doing for many years? Is this what I can see myself happy with after I get out of vet school? And for me, that answer was definitely a yes. So, if you guys are going to be doing this, just kind of make a mental note about what you want to get out of it, what you're looking forward to, and Just smile, don't be nervous, and just learn, because that is the whole point. So thank you guys so much for watching, and I will be making another video today, continuing my vlogs. Good luck, and bye.